Hello, everyone, and thank you for joining us. I'm Casey Minnis, Director of Communications for the Multiple Sclerosis Foundation. And for this National MS Education and Awareness Month teleconference, I'm joined by Dr. Fred Foley, who will talk to us about building emotional resilience. This presentation is made possible with support from Biogen, EMD Serono, Bristol Myers Squibb, Genentech, Novartis, Viatris, and Sanofi Genzyme. We also received additional support from Ocrevus. Now I'd like to take a moment to introduce you to our speaker. Fred Foley is a professor of psychology at the Furkoff Graduate School of Psychology of Yeshiva University and research assistant professor of neurology at Albert Einstein College of Medicine in the Bronx, New York. He also directs the Neuropsychology Service and Psychological Research Program at the Multiple Sclerosis Center at Holy Name Medical Center in Teaneck, New Jersey. He has published over 130 peer-reviewed scientific articles and book chapters, and his translational research on depression and immune dysregulation in MS won the Dorfman Award from the Academy of Psychosomatic Medicine. He's served on the Medical Advisory Committee of the National Multiple Sclerosis Society and the Board of Governors for the Consortium of Multiple Sclerosis Centers, which is an international organization dedicated to professional medical education in MS. The latter organization dedicated an annual award in his name in 2016, the Fred Foley Award, which is given to a person who has contributed greatly to the advancement of treatment for neuropsychiatric disorders in multiple sclerosis. He's been the recipient of numerous research and educational grants from the federal government and from private foundations, has served on many scientific committees, nationally and internationally, and has been an advisor or consultant for numerous for-profit and nonprofit organizations. He's a widely sought-after lecturer, speaker, and consultant, both nationally and internationally. And today, you'll understand why. We're so delighted to have him join us today for this really important topic. Dr. Foley, I'm happy to turn it over to you.
Thank you, Casey. And if you can enable my screen sharing, I'll be able to share my slides.
Apologies, we missed that step. One moment. There you go.
Welcome, everybody. So while I'm speaking, if someone has a question, you can raise a virtual hand on your screen, and that should allow me to see who you are. Then you can unmute yourself and ask your question. As soon as you're done commenting or asking a question, please mute yourself once again. We'll try this and see how well this format works, because if I have you all wait till the end for questions, some of you may think of things that you don't remember at the end. So we'll give this a try. So today I was asked to talk about how to build resilience. And resilience is something that we're very interested in MS. So many of us have observed that some people are able to bounce back after adverse events more quickly than others. And even when this group of people are very stressed, they seem to be able to maintain optimal functioning in their life in a kind of more advanced way. And we've observed that resilient individuals with MS, I mean, they get stressed, they can get anxious, they can get depressed, but they tend to maintain pretty good functioning, even if they do experience anxiety, depression, or extreme stress. And we've observed that they stabilize their moods more quickly and in general are optimistic by nature. Our group developed the Multiple Sclerosis Resiliency Scale and published it in 2018 in Rehabilitation Psychology. And we found several things emerged from our study of resiliency when we asked the question, what makes people resilient? What makes persons with MS resilient? And these are the things that emerged from our research and our components of the MS Resiliency Scale. Maintaining optimistic and positive attitudes was a key component to it. And the ability to use cognitive coping strategies when stressed was another highlight. And I'll discuss that a little bit later, what that means. Engaging in regular physical activity contributed significantly to resilience in people with MS. And engagement and support with other persons with MS was a component. And finally, engagement and support from family and friends was another important component. The good news about these aspects of resiliency that we kind of discovered is that you can teach them. We're working now on teaching people, how to be more resilient. And I'm going to give you some key tips. 10 tips for improving your own personal resiliency. Okay, even in the face of MS, and even in the face of all the curveballs that life will throw at you and stressors that we undergo. So, first, a key strategy is learning how to breathe properly. Now, we all know how to breathe, those of us that are alive. And but there are ways of breathing that will kind of trigger your parasympathetic nervous system. The parasympathetic nervous system is the relaxation arm of the nervous system. If any of you in the audience know a stress eater, someone who gets stressed out and they head for the ice cream, and they feel much better. The reason they feel much better is that when you eat something, digestion begins almost immediately, and digestion triggers the relaxation arm of the central nervous system, the parasympathetic nervous system. But you don't have to eat to trigger a relaxation response. You can do it by breathing properly. And so, the key component of breathing to increase your relaxation is breathe deeply, but make sure your exhalation is about twice as long as your inhalation. That's the key that tells your body to trigger the relaxation response. So if you exhale more slowly than you inhale, and I want you all to practice this with me right now. We're all going to take 3 slow, deep breaths, letting your exhalation be twice as long as your inhalation. The way I do it is I breathe in slowly through my nose and then out more slowly through slightly pursed lips. Pursing my lips helps me control my rate of exhalation. So ready? We're all going to take 3 slow, deep breaths. Okay, hopefully many of you noticed a slight difference, after breathing in that way, feeling just a little bit more relaxed, even just after 3 long, slow, deep breaths in that way. So this will give you better control over stressors when they hit you. If you practice this every day, breathing in this way for just a few minutes, you'll train your nervous system to have a relaxation response much more quickly in the future. So, second, building on breathing is meditation. Just a few minutes of practice per day, not only does it ease anxiety and combat stress, but there's been some publications on what happens in the brain when people meditate. Functional magnetic and structural magnetic resonance imaging studies of the brains of meditators, and these are not people with MS, they're just people who practice meditation every day, have found that there is better intrahemispheric connectivity in the brain for people who practice meditation for 15 minutes a day. And structurally, an area of the brain called the hippocampus grows with meditation. The hippocampus is an area of the brain that is important in new learning and memory. So since memory problems accompany MS, we encourage people to breathe and meditate for a few minutes each day. Now, those studies have not yet been done in MS, the imaging studies, and what happens in the brain with meditation, but they're definitely on the planning board at the moment. So, how do you meditate? I'm going to give you a simple, quick lesson in meditation. So, and the way to do that is, okay, I'm going to have everybody meditate along with me. How does that sound? For 5 minutes. We're going to do 5 minutes of meditation. This is the second skill to build your resiliency, and it builds upon the breathing. I'm going to ask you to take deep breaths during the meditation exercise, and when you breathe, after I ask you, make sure you have your exhalation be twice as long as your inhalation in the way that we described. All right, we're ready to meditate? Okay, stretch your muscles a little bit. Okay, make sure your body's comfortable, that you're in a physically a comfortable position. Okay, and if at any time during the 5-minute meditation exercise you have an itch, just scratch it, or if you're uncomfortable, get yourself physically comfortable. All right, now you're going to notice that you will be distracted during this meditation exercise because our minds tend to wander. It's okay. The important thing about meditation, it's not if your mind wanders away, it's just taking note of it and saying to yourself, oh, I was distracted by the sound of his voice, or the sound in this room, or my list of worries popped into my head, or my list of things to do. Just be the objective observer of your own subjective behavior. Make an observation of what distracted you, then gently return your attention to the meditation exercise. And it doesn't matter how many times you're distracted. Do not be concerned about any and all distractions. Are we ready? All right, meditators, we're going to begin. Oh, also, try not to have your arms or legs crossed when you're meditating, because this induces peripheral vasodilation, and you don't want to interfere in that relaxation process. You want to vasodilate when you're meditating, and crossing your arms and legs puts pressures on arteries and veins and can prevent that vasodilation. So we want to encourage you all to dilate. Okay, now I'd like you all to begin by closing your eyes and taking, unless you're driving in your car at the moment, of course, close your eyes and take 3 slow, deep breaths in the way that we described, allowing your exhalation to be twice as long as your inhalation. And then just allow yourselves to breathe at whatever's a comfortable rate and a comfortable rhythm for you. And I'd like you to begin by focusing on relaxing the muscles in your body, beginning with the muscles of your forehead and scalp. Picture the muscles in your forehead and scalp becoming smooth as you allow them to relax a little bit more. Allow the relaxation to flow down into the muscles of your eyelids. As you allow your eyelids to relax more and more, it will almost feel as if they are getting heavier and heavier, more and more relaxed. Allow the relaxation to flow down into the muscles of your jaw hanging a little more limp, a little more loose, a little bit more relaxed. Picture the relaxation flowing down into the muscles of your shoulders and upper back, down your arms. Picture the muscles relaxing, your shoulders hanging a little looser as you allow the relaxation to flow down through your body. Take a slow, deep breath. Really stretch out your abdomen and diaphragm. And then allow the muscles there to relax completely. Picture the relaxation flowing down into the muscles of your lower body and your legs, and even the muscles of your feet. As you're allowing your body to relax just a little bit more, I would like you to focus now on your breathing cycle. Notice the natural relaxation that occurs in the body as you begin to exhale and let go of your breath. There's a natural letting go, and your muscles will relax just slightly more. Focus on your breathing. And in your mind's eye only, say the word one silently to yourselves each time you begin to exhale, each time you let go of your breath. Do not be concerned by any distractions. Simply take note of it, observe it, and then gently return your attention to keeping the muscles in your body relaxed. Gently return your attention to saying the word one silently to yourselves each time you exhale. I'm just going to allow you to practice this quietly for 1 minute. And once again, take 3 slow, deep breaths, letting your exhalation be twice as long as your inhalation. And now I'm going to count backwards from 5 to 1. And as I do so, you will allow yourself to feel refreshed, relaxed, yet alert. 5, 4, 3, eyes open. 2, 1, refreshed, relaxed, yet alert. All right, take a deep breath, stretch a little bit. Now, that's meditation. That's all there is to it. So it's, very simple to kind of breathe the correct way and to relax your muscles and to keep your attention focused on your breathing in that way. So if you do that for 15 minutes a day, you know, or 10 minutes a day, or if 10 minutes is too long, 5 minutes like we just practiced it now, you will find that, again, you will get better and better control over your response to stress. And you will build your resilience by getting better control over your emotions when the world is turning upside down on you. Okay, now about 80% of people like this kind of meditation. About 20% of people tell me they don't like it. It irritates them, or it actually makes them more anxious. So, you know, we're human beings, we're not machines. We all have to find our own pathways to building resilience and to stress management. So if you didn't like it, that's okay. No worries. It just means that you need other pathways to build your resilience. And we have a bunch of other tips for you in today's talk. Okay. Being present is another way of being building resilience. It's called mindfulness. Being mindful means being totally in the present moment. If you ever felt anxious in your life, and we all have felt anxious at times, we're human beings. Anxiety is the feeling that you feel when you expect something's going to happen in the future, and it's going to be negative, it's going to be bad. So it's important to remember that anxiety is always about the future. It's never about the present moment. So by teaching people to be mindful, by teaching people to be focused exclusively on the present moment and not leap into the future with those negative expectations of something bad going to happen, it's a technique that helps you control your anxiety, being fully in the present moment. Now, let me give you some examples of that. If you're outside, notice the next time you're outside, you know, how the air feels on your face. Be aware of the temperature, all sights and all sounds around you. Notice the emotions that you're feeling. Notice the colors and everything, you know, and the textures of something you may be sitting on, you know, or the car seat if that's what you happen to be sitting on. Just pay attention to sight, sound, temperature, pressure, your body position, your muscle tension, you know, and kind of take it all in. And that's one example of being fully present. When your mind wanders, or if it jumps into the future, just say to yourself, oh, there I go, leaping into the future again. That's why I just felt that anxiety. Let me stay focused, you know, on the present moment. So come back to the present. If you're eating, the next time you eat, and most of us eat multiple times a day, so eat slowly. Enjoy the texture and taste of each bite of food. Really look at the colors in the food that you're eating. Stay focused on all the subtleties and the flavors of whatever it is you're eating. If you're conversing with a loved one, a family member, or a friend, again, stay kind of fully present in that conversation. Switch your focus from being fully present in the conversation to being fully present on taking your next bite of food. So when you're conversing, put your fork down and converse and listen and be fully present for whoever you're with. Then be fully present for your next bite of food and change your focus to that. You will feel much less tense and much less anxious if you practice mindfulness. And the more you practice anything, it's a skill like learning how to read or any other skill. And if you practice it, you will get better and better and better at it and be able to master your emotions, and you will build resiliency. Reaching out to others. Another thing we discovered in our resiliency studies in MS is that it's important to reach out to others. You know, it doesn't matter whether you're an introvert or an extrovert or what kind of personality you have. It's important to build your network. And in our MS studies, we found that two areas were important. Reaching out and being part of an MS community, reaching out to others who have MS, and organizations like this are wonderful at bringing you all together and helping you become a community. So talk to others, preferably via video or face-to-face. But if you can't do that, well, at least on the phone. When in doubt, reach out. Building your social connections. And introverted people frequently don't like a lot of social connections, so just strengthen a couple of connections, that's all. Or target one friend, one family member, one acquaintance that you have, and say to yourself, I'm going to strengthen that connection. I'm going to call a little more often. I'm going to email a little more often. I'm going to video chat a little bit more with that person. Start by just reaching out to one person and strengthening the bonds of that relationship. That will build resilience, as we have found in our studies. When you do reach out to someone too, first, be a good listener. Listen to what they have to say. You know, people love good listeners. They naturally feel attracted to good listeners. They want to be with you if you're a good listener. So be a good listener. And first, then share what's going on in your life. Share things that you want to say. But if you listen first and then share, you will find that that is a formula for strengthening that friendship, that love, or that relationship. So building out your social network. Okay, tuning into your body. When you have MS, there are many changes that can take place in the body. So sensation can change, muscle tension can change with spasticity. There are many different symptoms, as you know. So the important thing about, you know, getting to know your body with MS is particularly finding out how stress is impacting your body. So mentally scan your body, and that's one of the things the meditation exercise is good for. Scanning your body from head to toe, seeing if you can relax, you know, your muscles throughout your body a little bit more. Now, certain symptoms will interfere in your ability to relax muscles more, such as weakness or spasticity, or sometimes pain, you know, will interfere as well. But don't focus on those areas of your body that, you know, where your MS symptoms are preventing you from relaxing that particular muscle group. Focus on the rest of your body where you can kind of enable and empower those muscles to relax a little bit more. So, you know, in those areas of your body where you're feeling a little muscle tension or stress, kind of breathe deeply in the way that we told you, and imagine each deep breath flowing into that body part, whether it's the muscles of your jaw, muscles of your back or shoulders, or you know, muscles anywhere in your body. Just picture that deep breath flowing, you know, into that area of tension and relaxing those muscles there. So again, you know, another technique that some people find, and some of the persons with MS I've worked with find, helps them get better control over the stress in their lives, gets better control over their emotional reactions to very distressing things that, you know, occur in people's lives. I mentioned at the beginning of the talk using cognitive coping strategies. So I want to explain a little bit about what that means. So our moods in MS, they're dependent on a number of things. We know, for example, that depression in MS is in part dependent on lesion location in the brain. You know, part of it is a reaction to having MS and all the changes that go along with MS. But, not all of depression is determined by brain lesions. And there's a lot of it that is, kind of amelioable to be changed. And so what we ask people to do is to look at their wants and expectations, because our wants and our expectations about our daily lives generate our mood in part. For example, we already talked about anxiety. Anxiety occurs when you're leaping into the future. You're expecting something negative is going to happen. And, I hear this all the time from people with MS that I work with. I've had another exacerbation. It's going to be all downhill from here, they might say. Or, things like that. Well, they don't know that. They're projecting into the future the worst possible outcome when there are many possible outcomes. Stay in the present. Deal with the symptoms now. Get the best treatment now. And just stay focused on, healing from this exacerbation. And don't leap into an uncertain future that when you're generating, the worst possible outcomes. So stay present, focused. So anger. Now, have any of you ever felt angry with anything? So of course we all do. Anger is the feeling that you feel when you expect or want something, you're not getting it, and you still expect or want it. So think about that. Anger is generated by your wants and expectations. Things that you want, things that you expect from yourself, maybe from your body, from your people, from your employer, from family members. You're expecting, you're wanting something, you're not getting it, and you still expect or want it. At that moment, you will feel anger. It might be mild anger, like a little frustration, or it could be a lot of anger. What we ask people to do, and anger is, it stresses your body out when you're chronically angry. And if you find yourself being chronically irritated by something, your expectations or wants are probably need to be changed. I can give you one example from my life. I live in New Jersey, and the university and the medical school that I work at are in the Bronx. And I cross over the George Washington Bridge, and the busiest bridge in the United States, and the Cross Bronx Expressway, the busiest highway in the United States, on a regular basis, pre-COVID. And I used to get frustrated when the bridge would be closed again, or there'd be traffic or another accident. And I realized, I said to myself, Fred, come on now. You're expecting there to be a clear road on the busiest highway in the country every day when you travel? No, of course not. And once I changed my expectations that, okay, I don't know what's going to happen today. I might be stuck for hours. I might not be. When I was able to accept that, I was never frustrated again in traffic, period. It just happens. I accept whatever happens now. I'm not expecting, the gods to clear a path for me to get to my my destination. So this is the key thing of managing chronic irritation and anger. Think about things that chronically irritate you, and evaluate what your expectation is. Is it realistic? Is it realistic? If not, if you're expecting someone to change, for example, well, how often do people change? Not very often, and probably not when you want them to. So you have to evaluate with whether what you're expecting from other people that you may be chronically irritated with or frustrated with is realistic or not. And if it's not realistic, then change your expectation. Just accept them exactly the way they are, doing that same irritating thing over and over again. And if you can accept that, you'll find your frustration and irritation will disappear. It will go away, leaving you in a better emotional space. So getting people to use cognitive coping strategies means getting them to understand and track what are they wanting, what are they expecting, and You know, are those wants and expectations realistic? Do they need to be changed? Are they leaping into the future? And when you leap into the future, you know, when you're anxious, you're leaping to the most negative place. So, you know, ask yourself how important the thing you're worried about is going to be 5 years from now. You know, try to kind of get yourself back in perspective again. And if you're worried about your MS in the future, again, no one holds a crystal ball. You know, you have to stay kind of focused on the present and maximize, you know, all the things you can do to take care of yourself and get the best medical care you can. That is being productive. So, and will help reduce your worries about the future. Another emotion, sadness. Well, sadness occurs when you expect or want something, and then you give up hope of ever getting it. So we want or expect something, we're not getting it, we give up hope of getting it. At that moment, you'll feel sadness, you'll feel loss. Loss and sadness come with MS. They come with any chronic disease because we've changed us. We've experienced a real loss. And sadness goes along with that. If you find yourself feeling sad most of the day, nearly every day, you know, for week after week though, that is more likely a clinical depression, which is very common in MS, and we know can be successfully treated most of the time. So if you are depressed, don't ignore it. Complain loud and long to your doctors. I want help with this depression. Help me, and get the help that you need. You know, so and we know that that psychotherapy, a particular type of psychotherapy called cognitive behavior psychotherapy, that uses these cognitive coping strategies I'm describing to you today, you know, just briefly today, helps fight depression successfully. There have been multiple clinical trials done of this. I conducted one myself and found that by identifying our wants and expectations and changing them, we can significantly lift anxiety and depression in persons with MS. So use cognitive coping strategies. If you're depressed or anxious, kind of complain about it, get help for it, do something about it. Okay. So many people that I've worked with had expectations about fairness. They say to me, life is not fair to me. And we all have a sense that there should be fairness in life, but where do we get that sense from? Fairness has nothing to do with life. You know, when I walk through the pediatric cancer ward at my hospital, it reminds me of that all the time. Or, fairness has nothing to do with life. So if you find yourself inwardly upset because things are not fair, if you can change that, accept that life isn't fair, and you'll find yourself kind of much less frustrated and sad. Okay. Laughing. It's important for all of us to laugh a lot every day. And a good belly laugh just doesn't lighten your load mentally. It lowers stress hormone cortisol in your body, and it boosts brain chemicals called endorphins and stimulating neurotransmitters in the central nervous system. Laughing is good for your central nervous system. And so kind of binge watch your favorite sitcoms or humorous videos. Kind of connect with somebody who makes you smile, somebody who's naturally lighthearted or makes you laugh. Joke around with friends and family. Laugh every day, multiple times a day, and you will build resilience. And in the process, you can build relationships as well. You know, if you can not take yourself so seriously and kind of joke about yourself or other things, you know, people like that. You know, you can build relationships at the same time. You can kind of build resilience by finding the humorous side of life. And believe me, there is a humorous side of life. and it's out there waiting for you every single day. Search it out, find it, enjoy it, and most importantly, laugh about it. Okay. Okay, listening to music, crank up those tunes. Research has shown that listening to soothing music lowers blood pressure, heart rate, and anxiety. So, and there's so many apps for music and so many apps for nature sounds, babbling brooks, birds chirping. I like, my wife and I like playing an old CD that we have of thunderstorms and rain on a lake at night. And listening to that just makes me feel like I'm camping outside, and I find it so relaxing. And so find a sound, or music that is soothing and relaxing to you, and listen to it. All of these things that I'm mentioning to you will build your resilience. It will enable you and empower you to fight stress more effectively, to regulate your emotions, even when you're kind of facing terrible stressors. I didn't make these things up. I learned these things from my patients with MS, from working with them for over 40 years now. They taught me about resilience. And by observing what they do, by studying it and researching it and finding out and asking the question, what makes them resilient? These are the things we've learned. Okay, get moving. Exercise is very, very important. And we found in our resiliency studies in MS, it's a cornerstone of resilience in MS. You have to find the exercise that's compatible with your MS, and your MS symptoms. So, and many persons with MS ask me about that, and I advise them to talk to their physician about it, talk to their neurologist, or get a physical therapy consult so that they can learn how to exercise safely. That is mindful of their MS symptoms, so that they kind of can do it in a safe and effective way that will build aerobic capacity and strength, as they need it. So stretching is also important in MS. So combining, and physical therapists that work with our MS patients tell me this all the time, that they always combine stretching, aerobics, and strength training when they can in people with MS, in ways, of course, that are tailored to the needs of that individual human being and that person's MS. Because as we know, no two people have the same MS. It's a little bit different for everybody. So, but getting moving is key. So also, practicing gratitude is very, very important. What are you grateful for? Keep a journal of it. Make a log of it. Remember all the things in your life that are going right. What things are you grateful for? What gifts has life given you? Focusing on being grateful for the things in life that you have, the gifts that you've been given, is an important aspect of building resilience. Use your journals to remember good experiences, like a particular birthday party you had, a sunshine-filled day, any happy events in your life. Kind of focus on them. And when you start feeling stressed, spend a few minutes to look through your notes, to remind yourself about what things really matter in your lives. What's important? What are you grateful for? So all of these things, these 10 tips I've given you have been proven to increase resiliency, which will enable you to much better handle stressors and losses as they come your way, and regulate your emotions and bounce back quicker from them. I have an 8-year-old grandson who was born resilient. He is just remarkable, in terms of his ability to regulate his emotions. I was telling my wife, and he's been living with us largely for the last year. So we've had close opportunities to observe him. He gets stressed out by something, or he can't do something he wants to do. He says, oh, well, and he just moves on to the next thing. It's remarkable. So we know that resiliency can, we're born with certain amounts of it. And some people, like my grandson, are born with a great deal of it. Some of us are born with very little of it. But what we do know is that you can learn it and that we could all get better at it. So I guess I'll kind of leave some time for questions in case there are any. So it is time for questions or comments, or if you don't have any questions or comments, then I'm collecting good fish recipes, so you can please offer one of those. Okay.
Okay, so to ask a question of Dr. Foley, you have two options. You can either press the chat button and type your question into chat, or you can use the raise hand feature. If you are on a mobile device, you will find that by touching your screen and hitting the button that says more with the three dots. If you're on a computer, you'll click the participants button and you'll find raise hand as an option on the bottom of that box. I see that we have a question from Anita. And okay, Anita, go ahead and unmute and ask your question.
There we go. All right, are you able to hear me?
Yes, we are.
Okay, my question has to do with the progression of MS and resiliency, and if there is any effect on the long term of MS on your ability to handle stress. For example, I'm now in my early 70s, and I find that I get irritated so easily. Little things like I have balance issues, and so usually once a day or so, I stop myself from a fall, or I drop something, or I bump myself, and those things just annoy me. And having to handle anything with the utility company or my electronics just kind of just puts me into a high stress arena. So my question is, does MS play a role in that, or is that just aging, or is that just me?
That's a great question, Anita, well articulated. And it could be all three, that are involved in that. But think back to what I said before about cognitive coping strategies. Irritation is a mild form of anger, and it's due to your expectations or wants. You expect your body to work the way you want it. You expect it to keep its balance. You expect to be able to hold on to things and not drop them. Well, if that's part of your MS, you may just need to accept that. Okay, I dropped it again, or caught myself again with my balance. And if you can accept that, instead of expecting things to be otherwise, your irritation about it will disappear. So you gave a couple of other examples, but my aging brain forgot them, already. So, but I just examine whatever it is you're expecting or wanting, Anita, and adjust those expectations to ask yourself, are they realistic? Is it realistic for you to keep your balance all the time if you have MS and balance problems? The answer is no.
Well, part of the issue there is not just the expectation of wanting to maintain what I've had all my life before, is also the underlying fear. I live alone, and if I fall, it's a scary thing. There's a fear there that I can't just easily dismiss.
You're speaking about a realistic concern. When you're living alone, and you have MS and you're a little older, middle-aged, will you are more vulnerable. That's the reality. And so, people do the best things they can to be less vulnerable under those circumstances, to soothe their fears, like wearing life alert bracelets or other kinds of things, having family and friends check in on them a couple of times a day. So there are things that that we can do to lessen the stress of the very real vulnerability that you know, when you have MS and you're in your 70s and you're living alone, presents you. That is a reality. You are more vulnerable. Mitigate it by doing everything you can. So even though maybe you'll still be just as vulnerable, but you'll be much less stressed about it and worried about it.
Oh, I like that idea. Thank you.
You're welcome.
I will work on that because, yeah, it is very real. And I do some of those mitigation strategies you mentioned, but the fear is still there. But I will work on the 10 tips you gave us today to see if I can't at least reduce my anxiety about it.
Yeah, sure. Anxiety can be useful if it leads to effective problem solving. You know, when we jump into the future about how do I solve a problem, sometimes anxiety can be helpful, but many times it is not helpful, you know, because it doesn't lead to effective problem solving. Worrying about falling when you're living alone can lead to effective problem solving, you know, like getting the life alert and getting check-ins and putting in place procedures to reduce your vulnerability. But after that, it's not helpful at all. So, you know, so use it well to problem solve, then drop it.
Okay, thank you.
You're welcome.
Thank you for your question, Anita. All right. And do we have any other questions, folks? If you can't find the raise hand button, feel free to raise your physical hand. We'll try and spot you. Okay. Well, any comments on today's program? Anything you particularly enjoyed or learned? We'd love to hear from you.
Casey, I see a raised hand from Stephen and Janine.
Okay, let's see here. Janine, I spotted, so we'll start with you. Janine, I pressed the button to ask you to unmute. You should have a button on your screen. There you go.
The meditation, doing meditation. I've been doing that every morning. It has helped me out so much.
That's great, Janine. I'm so happy to hear that. How do you think the meditation has helped you?
It's helped me being able to control my senses, how I feel, you know, not stressing out, don't worry, you know, anything like that. It's helped me out so much with that.
Well, good. Congratulations on building your resilience. So that's excellent.
Thank you.
So audience,
keep up the good work.
Yep, you can see it. It works well for Janine. It'll work well for 80% of you.
Okay, Stephen, I've hit the button to ask you to unmute. You should get instructions. Doesn't seem to be working for you. Does anyone else have a comment or a question they'd like to share? Okay, let's go with Mark. I've hit the button to ask you to unmute. Go ahead.
Yes, all right. I get you know, like the coping and things to do to cope, but for someone that is like, I'm younger and I've had MS for almost 10 years now. I've tried some of those things that you talked about before, but it still weighs heavy on me. And I just want to, is there more that I can do?
Yes, you know, to learn all these skills is not easy. You know, it takes practice and work. That's why we frequently need coaches to teach us these things. And, you know, getting a licensed mental health professional who understands MS well and understands resilience, can kind of guide you to get a better skill set to use these strategies more effectively and apply them, help you learn how to apply them better in your everyday life. So I would recommend that strongly. I recommend that, get an instructor, get a psychotherapist, a psychologist, or a licensed clinical social worker who knows MS well, worked with a lot of MS patients, and can help teach you these skills.
Oh, that sounds wonderful. Is there like a list of doctors where is there somewhere I can search those specific type of doctors, or do I just have to, what do I have to do? I guess I'm asking, what do I have to do to find those type of what you were just describing?
Sure. Mark, start by asking your neurologist and your healthcare providers, for local referrals. That's where it makes sense to begin. And also, there's an organization called the Consortium of MS Centers that has kind of comprehensive care MS centers around the country. So if there's a comprehensive care MS center near you, they'll have a mental health professional who is an expert in MS. There's the National MS Society may have some referrals. I know they used to, have some, and they're, and I would kind of look into, the other MS organizations that are out there as well to kind of explore and search for the right therapist for you.
Okay, thank you very much.
You're welcome.
Thank you for your question, Mark. Okay, and our next question is from Dorothy. Dorothy, you should have the option to unmute. Go right ahead.
Hi there. Thank you for taking my comment question. And I actually didn't come in time because I was traveling. So I'm going to go back and listen to the whole webinar, but I came in towards the end here and I like what I heard. I've had MS for 27 years. It was relapsing remitting. I was always told that it was MS light. And didn't go on a DMT until I was about 10 years ago. And I was a runner, a long distance runner, marathons, half marathons, every day for the past 25 years, up until about 2 years ago, I started to lose my leg and my left side became weaker. So not being able to run has been like a death in the family.
Sure.
And I just can't seem to get out of my funk because it was sort of my center and no other activity can make me feel like I had superpowers other than running. I've tried them all. I'm an athlete. I've done everything that that I could possibly do. And I managed to get running in for over 25 years. And now the past 2 years, I can't really, it's hard enough to even walk my dog now because of balance issues. Yeah. She's about 40 pounds and she can pull me down. I've landed on the cement many times now. So for me to even run or walk a couple miles is difficult and I can't come to terms with it. I know I've done everything that you've mentioned. I've tried it all, but I can't seem to get my mind wrapped around it.
Dorothy, losing a lifelong love that centered you and was part of who you are, like running, is a tremendous loss. There is no substitute for it. That was part of who you are, part of who you were, and represents a very, very real loss. You're not going to likely find another exercise or activity that will feel as good as that. You can find other activities that will feel good, but it's not likely that you're going to find one that will be to you as important as running was. So, you know, the grief that naturally accompanies a loss like you've experienced, you know, is very real, and there's no time frame on grief. You know, you probably feel it episodically the rest of your life, this loss. So, you know, I can personally appreciate that. I used to be a runner as well until I developed severe back problems that precluded that. And, you know, I had to adapt, and but it was a tremendous loss. So, you know, if your grief kind of turns into a depression, a clinical depression, well, then it's important to get help for the depression. Or, you know, if your grief is very deep, get some grief counseling. You're right. It is like the loss of a loved one, like the loss of a beloved family member.
It was harder to lose running than it was. I mean, I loved my mother to the ends of the earth and back, but her death, I was able to get over faster than I'll ever be able to get over this.
That reflects the size of this loss for you. And so you might want to consider grief counseling, you know.
I mean, I do have somebody I talk to, but no matter what I do, I can't. But you're right. I'll listen.
And also, it's important to find something about life you enjoy every day and focus on that. If you can't enjoy something about life every day, then it's no longer grief. It's a clinical depression, you know, which may need aggressive treatment, you know, so which usually combines antidepressant therapy or multiple antidepressants with cognitive behavioral psychotherapy. So, and some other interventions as well. Again, you're the only one who can determine that. If you are enjoying something about life every day, Dorothy, then it's just likely a very deep, lifelong grief that you will have. Over time, what happens with grief is usually the periods of grief becomes shorter and shorter over time. The intensity of it frequently doesn't change though. So it'll hit you like a wall of bricks, like, you know, but the time that you'll be feeling it will change. It will be for shorter and shorter periods of time as you fill your life with other things. I wish you the best.
Thank you.
You're welcome.
Thank you very much. I appreciate it.
Casey, can I say one thing? Do we have anybody else?
No other hands raised at the moment. Go ahead, Deb.
I just have a cute story that keeps coming back to me because you mentioned in depth the importance, Dr. Foley, on being a good listener. And I keep thinking of my Aunt Rose, who just passed away at 100 years old and 7 months. And the whole family for her 100th birthday got together, all the nieces, nephews, great nieces and nephews, great nieces and nephews, and we all did a video for her. And I would say out of the 42 people that were on that video, probably 35 of them said, what we love most about you, Aunt Rose, is that you are the most amazing listener on this planet. And that when we talk to you, you listen, you don't even comment until we're done. That when we're with you, you stare at us and watch us as we're talking. And it was so, to hear that, and then to hear you talk about the importance of listening, it just made such an impact that I haven't forgotten it the whole time we're talking. So, so thank you for saying that. And so, yeah, everybody loves Aunt Rose because of her listening. So anyway, thank you. That's what I want to share.
Thank you for sharing that. That's lovely.
Thank you. And we have one final question or comment from Anita. Anita, go ahead.
Hi, I just wanted to make a comment regarding Mark. I was diagnosed over 20 years ago, but I can remember being younger and facing MS. And all I wanted to say is everything that we've been told today in this conference has been right on and very truthful. I will say that you need to be your own best advocate, and you need to have a lot of persistence. When the doctor said to yell and scream and say, I need help with this depression, that's what you have to do. And if your current provider isn't meeting your needs, you have to find one. And if you live in a more rural area where your access is more limited, then take advantage of today's electronics. And I found what was most helpful was talking to other people in my local MS support group, because they had direct experience with providers in an area I had moved to. So I just want to say, Mark, if I may, like I say, no one is going to solve your issues but you. So be strong and follow the advice we're given today, and keep at it until you get what you need.
Thank you for sharing that, Anita.
Anita
Thank
makes
you.
a very important point about self-advocacy. You know, making sure you step up and advocate for yourself. If something's bothering you, you know, insist on getting help with it.
All right, on that important note, that is all the time that we have. So I'd like to thank all of you for being with us here today, for participating and sharing. I'd like to thank our sponsors and, of course, Dr. Fred Foley for preparing and sharing this information. I would also like to let you know that if you missed any part of this teleconference, that it will be available on msfocusradio.org, on the Foundation's SoundCloud page, and on our YouTube channel within just a couple weeks' time. You can follow us on Facebook, Twitter, Instagram for times and access information. Or subscribe to our YouTube channel and get notifications when new conferences are posted. Our next teleconference will be this coming Thursday, March 18th at 7 p.m. Eastern Time. The topic is, are you okay when it comes to intimacy? And psychologist and sex therapist Tracy Seidman will be discussing that topic. So we hope that you will join us then. Again, we thank you for joining us now, and thank you again to Dr. Foley for this wonderful presentation.
Thank you. It's an honor to speak to this wonderful group.